Welcome, everyone. My name is Maurizio Marinelli. I'm an honorary professor at the Institute for Global Prosperity at UCL, where I lead the Asia Prosperity Research Hub. For this term, my colleague, Dr. He Yuan, has organized a lecture series on the theme of gender and prosperity in Asia. I'm absolutely delighted to introduce the second speaker of our series, Dr. Alessandra Aresu, that I've known for many years. Dr. Aresu is a gender, sexuality, and disability specialist dedicated to promoting sexual and reproductive health and rights for all, with particular attention to young people and persons with disabilities. Dr. Aresu's current work is rooted in the research and development work that she conducted in China throughout the years. She holds a PhD on gender and sexuality education in China from the University of Westminster, 2006, and she also conducted postdoctoral work thanks to a fellowship from the Jiang Qingguo Foundation at the University of Bristol between 2007 and 2009, when I was there at the University of Bristol at the time. So I've known Alessandra Aresu for many years. And then after her postdoc, she moved back to China, where she worked as a country director of the China program for the international NGO called Humanity and Inclusion. From this position, Dr. Aresu led the design and the implementation of the first pilot projects on gender, sexuality, and disability that was developed in China in close collaboration with local organizations of persons with disabilities and also with international partners. Building on this rich and unique experience, in 2017, Dr. Aresu started promoting sexual and reproductive health and rights of persons with disabilities globally, and disability inclusion in the health sector more specifically. Today, Dr. Aresu is the director of the Global Inclusive Health Division of Humanity and Inclusion. And she's well known for her advocacy and influencing work conducted in partnership with international organizations and through several global networks. For example, she led the establishment of the first Disability Inclusive Health Task Force at Core Group, for which she served as a co-chair from 2017 to 2019. And today, Dr. Aresu serves as a co-chair of the Inclusive Health Task Group at the International Disability and Development Consortium, and also she works in the Health Inclusive Working Group at the Global Action on Disability, networking partnership with UN agencies and other global health stakeholders. Dr. Aresu is also the author of several articles and book chapters. I will just mention a couple of them here that could be of interest to the audience. The first one is When Sexuality Meets Disability, Experiences, Attitude, and Practices from China, that was published in Diverse Voices of Disabled Sexualities in the Global South, Palgrave Macmillan 2019. And the second article that I want to mention is Adolescents with Disabilities, published in Developing an Adolescent Competent Health Workforce, Training Services Providers in Adolescent Sexual and Reproductive Health, Pathfinder International in 2020. Today, the title of the lecture that Dr. Aresu will deliver is At the Intersection of Gender, Sexuality, and Disability, Experiences, Attitudes, and Practices from Asia. Please join me in welcoming Dr. Aresu to give her lecture today at UCL. Thank you very much for your attention.
The models that we have been using throughout the years to discuss disability, for many years, the evolution, the medical model was the one that was most prevalent. So the impairment was considered a problem that a doctor would fix. And with this medical model, the person with disability would remain forever a patient, not a subject of rights, not a person that really deserves the equal rights, simply someone that needs to be taken care of. And the disability movement has been working quite a lot to make sure that the medical model was no longer as prominent, and a new model came along throughout the years, that is the social model. And the social model, this is a very brief introduction, but you can read about this after the class, is the one that recognized that when we talk about disability, we don't need to focus only on the impairments, but we also need to focus on the barriers, as the definition of the CRPD has shown before. So these barriers are in our community, in our society, and they are a problem that needs to be fixed, and not the impairment of the person. And this is really a crucial change in the work that has been done on inclusion throughout the years. Of course, there is an additional model, that is the model of the rights-based approach, meaning that in addition to the social model that remain very valid today we talk about the rights of persons with disabilities and disability rights as human rights, and no longer only addressing the needs of persons with disabilities, as I mentioned before. So just to summarize, disability is the relationship between impairments and the environment. And if we make sure that the environment around us is accessible to all, then we are talking about inclusion. And of course, when we talk about inclusion and meaningful inclusion, we cannot only focus on disability per se, because we know that there are several intersecting discrimination factors: gender, age, sexual orientation, social and economic status, ethnicity, you name them. So when you talk about inclusion, you have to have this big frame that remind you that many different factors can be elements of discrimination, vulnerability, and therefore exclusion. And to work on inclusion, you need to work on the different factors. And this is the graph that really summarizes what we have just said. I will not spend more words on this. And as I said, the major change really that came along to in the last few years is really the introduction of the rights-based approach. So when we started discussing disability not only as a need-based perspective, but as from the rights-based perspective, our conversation really became so more meaningful. So as an example, when I say moving from the needs to the rights perspective, is that we are no longer discussing about the fact that the person with disability needs rehabilitation or needs to education. We are saying that is their right, and we are violating their human rights if we do not make any effort to really promote those rights and make sure those rights are fulfilled. The merit of this shift comes from the disability movement and is really captured in the United Nations Convention on the Rights of Persons with Disabilities that we mentioned before, adopted in 2006 and entering into force in 2008. And it's a legal binding convention. It was needed to make sure that we could move forward in promoting disability inclusion. And that then needs to be implemented at a country level through changes of laws and policies. And that is the most challenging part, and we will talk about it again. Because we are talking about intersectionality and an intersectional approach to inclusion, as a minimum, you have to, for example, if we want to talk about gender and disability, you have to, let's say, read the UN Convention on the Rights of Persons with Disabilities together with other treaties. For example, for a gender's perspective, the CEDAW is the one that I would read next to the CRPD. And the CEDAW is the Convention on Elimination of Discrimination Against Women. And full and effective participation and inclusion of men and women in society is one of the 8 cross-cutting principles of the CRPD. And this is really one of the core elements that help us to move from disability to at least a basic work on gender and disability. Just to mention some of the articles that are relevant for you when you go and read the convention, certainly you can find Article 6 that focus on women with disabilities, acknowledging that they are subject to multiple discrimination and therefore needs to be protected and the rights promoted. Article 16, talking about freedom from exploitation, violence, and abuse. Article 23, in respect to the home and the family. And this is really the core where we acknowledge that persons with disabilities, as well as persons without disabilities, have the right to be in a relationship, to get married if they want, to have children if they want, a right that was for a long time not guaranteed to many persons with disabilities. And then Article 25, that is on health, and specifically and explicitly refer to health, to sexual and reproductive health and rights of persons with disabilities, because from the beginning, the authors of the convention identified sexual and reproductive health and rights as one of those key elements that needed to be explicitly mentioned to make sure that is not forgotten. Well, we will soon find out, however, that despite all these efforts to really bring the rights of persons with disabilities up front, and specifically the sexual and reproductive rights of persons with disabilities that we are discussing today, and then the gender perspective on this, the experience tells us that even the disability movement was not ready to integrate a gender perspective in their work, because they were so busy really trying to protect the basic rights of persons with disabilities. And as often happens, gender, as in many other contexts, doesn't come as the first perspective. So it was in the papers, but when it comes to the implementation, it was very, very difficult to find. And that also happened for a very simple reason, that for many years, the disability movement in China, in Asia, and globally was led by men. So the space that men had, the women had within the disability movement to promote their own rights, and also to promote their own sexual and reproductive rights, they had very little space, because of course, when you we have to remember, as we said before, that all the elements related to gender discrimination based on gender, based on age, simply add on the discrimination linked to disability. And so in the end, what women have been and girls have been experiencing, even without disabilities around the world, of being discriminated and being excluded, we find it exactly with the same characteristic or similar characteristics among women with disabilities, so, with the exception that for them, the challenges were multiplied because of disability as an additional vulnerability factor. And often so, the needs and rights of women with disabilities were often remained invisible in the work of many scholars and within the context of disability movement. And I will tell you later, but in China, this has changed a lot, and in so many other countries now, it's not longer the case, but this is really the origin of the discussion. Things changed about 5 years ago, 7 years ago. I wouldn't say that more than 5-7 years ago, we were having the promotion of the rights of women with disabilities led and the establishment of women with disabilities led organization is quite a recent phenomenon. In a recent phenomenon per se, that is the disability movement, that is not, doesn't have 100 years of history. One additional thing that we can say is also that the feminist movement and the disability movement have been working in silos for a long time. And so when, of course, the feminist movement was promoted, the rights, the women's rights and the sexual and reproductive rights of women, there was no inclusion of women with disabilities in those movements most of the time. Of course, you can find plenty of exceptions, but the rule was that also the feminist movement has somehow forgotten at its beginning to include persons with disabilities and women with disabilities. On the other hand, as I said, gender and sexuality were not the top priorities of the disability movement, that were struggling already with rehabilitation, access to employment, access to education, and as often happens, gender and sexuality remain a little bit behind. Then why focusing on women and girls with disabilities? I think we have been saying this because usually international and national laws and policies on disability have historically been neglected, and really in laws and policies addressing women have traditionally ignored disability. So there is this double exclusion of disability when it was coming to laws and policies related to women, and of women and girls and gender in policies related to disability. And women and girls with disabilities, in fact, as we said, face more barriers. Let's see how and why. For example, they usually have 3 times more, they are 3 times more likely to have unmet needs for health care and sexual and reproductive health care. They face stigma and negative attitudes when accessing sexual and reproductive health services. They are 2 to 4 times more likely to be affected by violence, and they are really exposed to and experience really unique forms of violence that includes forced sterilization, forced abortion, forced pregnancy, forced continuation of pregnancy, denial or delay of safe abortion and or post-abortion care. And to come to the last point, when it comes to gender-based violence, services are usually not always accessible and inclusive of women and girls with disabilities. So these elements, I'm bringing them to you as a general point, but in reality, they are very much confirmed globally in Asia and in China. And unfortunately, it's very difficult today to find countries where there is a different messages coming through. There are better situations than others, better countries than others, but this is really the common situation right now. One question remains once I have described all of this, trying to link the global and the Asian context and the China context, and we will go in depth a little bit more in a minute. So if we bring back our question of why working at the intersection of gender, sexuality, and disability, why this is an important topic, I think you have a better idea now. But then the straightforward answer, as we said, is that sexual and reproductive health and rights of persons with disabilities have been consistently violated, and we cannot ignore this anymore. But the other answer that is more related to the international work of development is that you may be familiar with this, with the Sustainable Development Goals. In fact, Sustainable Development Goals 3 on health, for example, that focus a lot on sexual and reproductive health and rights. If we keep ignoring persons with disabilities, which represent 15% of the population, that Sustainable Development Goal will never be achieved. So in fact, and this is the reason why, in addition to the denunciation of how difficult it is for women and girls with disabilities to have their rights respected, there is also now a common goal to make sure that the Sustainable Development Goals are achieved. And this is a slide that really summarizes what we said before about violence against women with disabilities that are disproportionately affected by this phenomenon, and by very specific and unique forms of violence and abuse that we have already mentioned. Now, we have some data that are we have some data that we mentioned already. Over 1 billion persons with disabilities is living today in the world, and between 180 million and 220 million are young persons with disabilities, and predominantly living in developing countries. But now let's enter, really, because time is passing fast, to Asia and to China, to make sure that we also have a deep dive on this, even if, as we said, what you have heard, it's really applicable to Asia and specifically to China, which is our case study today. So if you look, I say that 1 billion persons with disabilities are have a disability as a minimum today in the world. Well, 650 million women, men, and children with disabilities live in Asia. So it's a significant context. It's a very meaningful context to discuss about disability inclusion Asia, because how populated is the region. And then when it comes to China, 85 million people live in China with disabilities, and about 8 million are young persons between the age of 10 and 19, and 40.19 million are women, and the total number expected, however, to reach is 165 million by 2050. So numbers, you know, let's make the numbers speak and talk. These are numbers that we cannot ignore. We cannot even ignore one person's violation, the violation of one person's rights. But when it comes to these numbers, we really need to hear what it is that we are neglecting or ignoring. And so if we search the archives, we can also find out that the commitments to promote the rights to sexual and reproductive health and rights of persons with disabilities, in fact, have been mentioned many times in Asia. For example, ensuring universal access to sexual and reproductive health and sexual and reproductive health services for all, including persons with disabilities, is an ambitious goal that was agreed more than 20 years ago in Asia by 179 member states, and globally by 179 member states, and reflected in the Program of Action of the 1994 International Conference of Population and Development, better known as Icpd, and again in the 1995 Beijing Platform for Action. And of course, here, this was also confirmed much more recently at Icpd plus 25, so 25 years after this major conference when that took place in 2019. So once again, for Asia, for China, for the world, the rights of persons with disabilities to access sexual and reproductive health and rights were acknowledged and recognized since long. Then more recently, you can see that Asia has taken the lead in really moving forward in promoting the rights of persons with disability, and in this strategy that is mentioned in this slide, 10 goals with 25 targets were really highlighted, with 62 indicators, really a huge effort to make sure that that there was an effort to move forward with disability inclusion in Asia. And goal number 6 of the regional strategy that we are mentioning here is dedicated fully to gender equality and women's empowerment, with the following 2 targets to be achieved by 2022, so tomorrow: to ensure that all girls and women with disabilities have equitable access to reproductive health services, and to increase measures to protect girls and women with disabilities from all forms of violence and abuse. Now, if I was with you in the room, someone would have already raised the hands and say, well, the 2022 is tomorrow. How are we doing with these indicators, and specifically with goal 6? And the answer is, we are not there yet. We are still far from being there. And when it comes to China, it is not necessarily a better situation, because China's policies and legal frameworks make no specific reference to the sexual and reproductive health needs and rights of young persons and adults with disabilities. What does it mean? That if we move from the Asian perspective to the country perspective and take one case of the Asian context that is the most populous and with the highest number of persons with disabilities in the world, we know that despite the global CRPD and the strategy that I have mentioned, still the policies and legal frameworks that are at the country level do not reflect fully the rights of persons with disabilities when it comes to sexual rights and reproductive rights. Again, when it comes to a disability perspective, it's not included in the current Chinese sexual and reproductive health policies and programs. And even the China's first anti-domestic violence law that is very recent, only it was only released 6 years ago. It does target physical and psychological violence against people with disabilities, but there is no discussion or mentioning of sexual violence. So here you see, with all our efforts to work at the intersection of gender, sexuality, and disability, at the global level, at the international frameworks level, when it comes to the country level, that is where the biggest challenge is. And it remains a challenge today. Very recently, WHO and the World Health Assembly has adopted a resolution called the highest obtainable standards of health for persons with disabilities. And I'm happy to provide a link to all of you so that you can read it. Is the best document ever promoted to promote a release to promote the rights of persons with disabilities when it comes to health, and therefore also sexual and reproductive health. However, if this document that has been adopted in May 2021 is not implemented at the country level, it will remain also word on paper. And for this reason, we all have the responsibility, no matter what type of job we do, we are students, we are researchers, we are NGO workers, to really remember that there is a role that we can play in reminding our authorities, our governments, our supervisors that the inclusion of persons with disabilities needs to be mentioned. What happens in China is that there is a lack of quality data, first of all. So when it comes to advocating for better policies and laws on sexual and reproductive health and rights, the data that are available are scattered, are not necessarily comparable. And so the first step that we need to keep in mind to move forward, to move the needle forward, is really to consider the opportunity of engaging in working on data. Qualitative data, quantitative data, depends on what you prefer engaging with at the local level, at the country level. This is essential for us. But of course, the major role that needs to be played is by the government, who put in place a system, and we call it of disaggregated data, so that when, for example, people go to the health facilities for a sexual and reproductive health check, we know if the person has a disability or not, and can be matched with the gender, can be matched with the needs of the person. And therefore we create a map. We have data that can be used to advocate for better laws and policies. Without data, we cannot go far away. So as students or as researchers, really, it's a pleasure to highlight this with you, because you have the power that sometimes international NGOs don't have in producing quality data. And the other issue that is present in China that really prevent those international frameworks to be implemented, as in many other countries, is the fact that for many years, the use of the rights-based approach to discuss sexuality and disability was limited. So it's a very recent one, and is a recent one that now is in use, but with all the challenges that we are aware of working on sexual rights and in China. advantage of working on disability, and this is a very personal experience, is that when it comes to disability rights, there is much less sensitivity coming from the government in promoting the rights of persons with disabilities. So let's say that for many years, also working in China and implementing project there, the benefit of an organization like mine and my work there is that we could, I like to say, enter from the disability window and the disability road and the disability rights door rather than other windows or doors, and make sure that as we were able to promote disability rights, then we were also able to bring in all the other subjects that could have been considered a little bit more sensitive in the context of China, let's say of 5 years ago. You can imagine even before, but it would be in many cases challenging today as well to discuss always and consistently about sexuality and disability. And this is something that we need to keep in mind when we set our ambitions really of working on at the intersection of gender, sexuality, and disability. The disability and sexual rights movement have not, as I said, a significant history of collaboration until 5 years ago. And this means that they were working in silos. And unfortunately, by working in silos, they have also reinforced some, let's say, some difficulties in promoting the rights of everybody, the rights for all, including women and men with disabilities. Because if we think about the work that the LGBTQI+ community is doing in China today there is a good connection with the disability movements, but only 5 or 6 years ago, the idea, or also, for example, the people who are living with HIV and the movement that is promoting the rights of persons who are living with HIV. If only 5 or 6 years ago, the idea that they could join forces with the disability movement was far away from their minds, because the conviction was that really it would have brought more burden and put them in this in a much more difficult position, rather than really see the positive and the possibility of joining forces for the same goal, which is the promotion of human rights for all, and in this case, sexual and reproductive health and rights for all. So for us, moving from a system of silos, from the work that the disability movement and the sexual rights movements were doing only 5 or 6 years ago, to today, where they work hand in hand, really has been a good change. And what we have also noticed in China is that there was a limited awareness among many young people about the with and without disabilities, about the rights of people with disabilities. So persons with and without disabilities were not aware about the fact that persons with disabilities can have a relationship, can get married, can have children. There was this very old-fashioned approach of looking at the person with a disability as a person, as a patient, as a person with an impairment. So defining the person with disabilities only by impairment. And again, this is true in China. It has been true in many other countries. And the final point also is that sexual and reproductive health information and services, because of all that we have described, remain today inappropriate and inaccessible for many persons with disabilities. And the ambition is really to work towards changes in this case. Now, I highlighted in my presentation that changes have happened during the last 5 or 6 years, and I was really honored, and sometimes you are where you need to be with your work. Sometimes I had the opportunity to be there when the disability movement was growing, and when also the movement that was promoting sexual rights for all was growing in Beijing. Of course, we are talking about Beijing and we are not talking about the entire China, but I was there observing and experiencing these changes. But I was also there for the very first time with the Disability Inclusion Organization. And what happened is that arriving with my background as a gender and sexuality specialist, I had my full network of contacts, researcher and colleagues and NGO colleagues that were really promoting the rights of sexually reproductive health and rights for all in China. And when I was there and we knew that disability at that point was neglected in this discussion, it was very easy, came quite natural for us to connect the dots between the work that the Organization of Persons with Disabilities that were already working for many, many years with my colleagues of Humanity and Inclusion based in China, and the connections and the contacts of colleagues that were working with me in my academic life on sexual and reproductive health and rights. So somehow, thanks also to very generous funds from a couple of important donors and the commitments of UN agencies like UNFPA and UNESCO, we managed to put together the first pilot projects on gender, sexuality and disability that created the first platform to discuss about gender and sexuality and disability in Beijing. I'm not saying that there was nothing there. There were, for example, in Guangzhou, experiences of small organizations of parents of children with intellectual disabilities that were promoting inclusion when it comes to sexuality education. However, that was a small reality that we, let's say, leveraged, that we brought with us in this big platform, bigger platform that we created to make sure that everybody who had an interest in sexuality and disability and had some time and energy to share with us could really have a role to play. These that you see are some of the results of the project that we promoted in China with Humanity and Inclusion. You will see, for those of you who can speak Chinese, this is a magazine that is published by a DPO based in Beijing called 1+1, but it's the biggest DPO in China. That for the first time, thanks to this project, have finally managed to bring into their work and publish articles and promote radio programs on disability, inclusion, and sexual and reproductive health and gender. And then we also promoted, developed a toolkit for inclusion on gender and sexuality and disability that is still available and can be really accessed if some of you are interested. These are just tools that practical tools that really enriched the literature and enriched the tools available to move the needle forward when it comes to disability, inclusion, gender, and sexuality. And later on, we also managed to promote a second project with UNESCO to collect the first data on youth sexuality-related knowledge, attitudes, and behavior in China. It's a small research, is a small quantitative and qualitative research. If I can tell you that this is a top quality research, I would say something that is not necessarily true, because I believe that there is a lot of gaps, but we had limited funds. But what makes the difference is that we had data to move forward with partnerships like the one with UNESCO, but also to move forward with a policy brief that in this case was developed with UNFPA, and that helped us to go to those who were our counterparts in the education context or in the China Disabled Persons Federation context that were discussing at the government level disability, and to highlight the importance of working at the intersection of gender, sexuality, and disability. And then there is an article that is the one that Professor Marinelli mentioned during my presentation, during the presentation of my profile, that somehow summarized the work that we have done in these projects, that is available. I can put it in a folder for you with the support of Professor Yuan, and to make sure that you can have these materials in hands, because of course 1 hour has already passed, and there are a lot of information in those in that article that really bring the voice of persons with disabilities forward, remembering, for example, how young people who are now colleagues from the 1+1 DPO that I mentioned before, the Organization of Persons with Disabilities, biggest in China, remember how they were going to school and find themselves discriminated by their classmates when they were trying to having a partner, having a date, or learning about sexuality education, or even voices that tell us how today, still today, a lot of parents of young persons with disabilities believe that to take care of their children, it is essential really for them to marry a person without disabilities, because they will really support them throughout their adulthood and their and later in life, knowing that, considering, for example, that this person with disability is not an autonomous person by definition. So looking at their children, looking at young people with disabilities as someone who needs to be supported and needs to be accompanied, rather than a person with that can enjoy an independent life. The same when it comes to discrimination. We have stories of women with disabilities who had no opportunity to choose their partners, that were convinced by their parents to get married with older men, or men living in the countryside who were having difficulties in finding a wife. And in this context, not so many men without disability would marry a person with a disability, but because of their lack of opportunities to find a wife, they accept a girl with disability. And this woman then it's certainly most vulnerable to discrimination, to violence, to abuse, and it's often considered a tool for reproduction. There is really a lot in this article that you could consider, and you can also look at the article at the roots of why persons with disabilities are considered necessarily, and this is not my words, but the words of some of my interviewees that I interviewed to prepare this article with my colleague Muriel Maxeng, who said that they were considered for a long time citizens of class B or C even, because somehow this was, they were told this was the case, and therefore citizens of class B or C did not deserve to date, to be in a relationship, to have the family they hope for, they dream about. And the self-confidence of persons with disabilities is often affected by this kind of messages that are really, really present everywhere, and that we need to be aware of when we try to really work at the intersection of gender, sexuality, and disability. I will stop here, because the next few slides are really the example of how we have moved from the China and Asia context with this lesson learned to the global context, and brought this in a project that today are present globally with humanitarian inclusion, discussing about how we can promote the sexual and reproductive health and rights of persons with disabilities. And the last image that I want to show you is this one. Of course, this is the Icpd plus 25 convention in Nairobi. And I was there with a very small group of young people with disabilities from Africa, in this case, from Uganda, East Africa specifically, because the conference was based there. So I didn't have the pleasure to have with me young people from Asia, but they were there promoting the rights of young persons with disabilities when it comes to sexual and reproductive health and rights. And what they left me with is a message that is, do not stop here, kindly move forward and keep advocating in more countries. So this is the message I leave with you, because we are all in the position to move forward. And I'm very happy to stop here and to hear about your questions and your inputs. And thanks again, and back to you in the classroom.